The bulk of emergency humanitarian operations globally occur in hot regions. Frontline emergency workers in tropical and equatorial climates work under very stressful conditions characterized by extreme heat and humidity, predisposing them to heat stress and related complications. In health emergencies, the extreme conditions also affect quality of patient care. Due to extreme heat and discomfort, health workers cannot spend more than 1 hour dressed in a full PPE. Globally, tents are the most commonly used structures for humanitarian service delivery. The traditional or standard tent has many positive features that make it attractive for humanitarian work. It is affordable, easily deployable, and durable. However, these tents are also poor at heat exchange when fully enclosed. Their materials transmit a lot of radiation, trapping hot air and creating a temperature buildup. PVC linings are continuous without aeration pores. The shape of the tent and the uninterrupted walls also promote a constant buildup of heat within the tent cavity, aggravated by the poor air exchange. The EpiTent design blends two adaptive technologies to achieve the temperature reduction: a smartly designed lean ventilation system and an appropriately designed heat absorption system using polymer. The tent sits on a 12 by 6 meter area and stands at a height of 4.6 meter, having 12 windows, 8 roof vents, and 2 entrances, allowing it to feel much cooler. It cuts the average ambient temperature by up to 7 degrees centigrade during the hottest 8 hours of the day in hot, humid climates using purely adaptive systems. Reduce extreme heat. The maximum temperature attained by the tent is reduced by 10 degrees centigrade, lowering the chances of heat exhaustion. Substantially reduce social exclusion. Patients face extreme boredom and stigma from the social exclusion caused by the closed-off environment in isolation units. The EpiTent, however, allows free perception of the outside environment, thereby reducing stigma. An assortment of accessories transforms the tent into a portable healthcare center, to mention a screen, lights, camera, power sources, hooks, tabletops, curtains, solar panels, among others. All these help in the monitoring process and providing a smooth communication between patients and the health workers. The tent is well enforced onto the ground with pegs distributed around its perimeter at each base joint, hence keeping it firm. EpiTent has a self-energized capability aided by solar power, considering most of the humanitarian emergencies happen in remote areas that have no access to power systems. PVC flooring complements cleanliness, protecting patients and health workers from water, dust, and mud. Infection prevention and control has been achieved through two aspects: unidirectional movement of both health workers and patients, and the EpiTent allows for disinfecting with 0.5 chlorine possible, which is best for preventing and further spread of infection, and in this case, not damaging the materials. The EpiTent avails us with endless shelter solutions, which does not stop at only isolation units, but also general health care and general emergencies. The EpiTent is the next generation tent, a tent that breathes.